Okay, so I'd like to wrap up chapter 13 with just the last few PowerPoint slides that we have and just kind of give you an overview of some of the spinal nerves that are coming off of these plexuses. And then we'll talk about the last topic will be about these things called dermatomes. So let's look at this. I'm going to go to our next PowerPoint slide. And I need to mention a procedure called a spinal tap. Spinal taps are a technique to sample cerebral spinal fluid. Now, the interesting thing about spinal taps is they're going to take a needle. And this needle is right here. You can see this really long needle. They're going to take this needle and they're going to insert it into the subarachnoid space of the patient's meninges. And they're going to then extract cerebral spinal fluid out. Now, this procedure is done to sample things like substance P to make a diagnosis. We can administer antibiotics, anesthetics. They may even administer things like chemotherapy into this region. They can measure the cerebral spinal fluid pressure to see if your brain ventricles are working properly, or those arachnoid villi in your brain that absorb cerebral spinal fluid, if they're working. They can look for infections. So if someone has encephalitis or perhaps meningitis, they can test and look at that cerebral spinal fluid to see if there's anything wrong with it. Now, the big thing about this is we can only do a spinal tap, also known as a lumbar puncture, by the way, but we can only do a spinal tap below L2 because it's too dangerous to try and extract cerebral spinal fluid from anywhere above L2 because we don't want to damage that spinal cord. Remember that there's no spinal cord between L3 and L5. So they call this a lumbar puncture because we can really only do it in the lumbar region. So they can insert that needle safely below L2. So they always do a lumbar puncture between L3 and L5, and they can make these determinations about the health of our cerebral spinal fluid. Remember, cerebral spinal fluid should be clear, colorless, and odorless. So if they extract some cerebral spinal fluid out and it is discolored, it has anything wrong with it, then they know that there's a bacterial infection or something else is going on. All right, let's look at some of these spinal nerve branches off these plexuses. So one that I wanted to mention was the ulnar nerve. Remember, the ulnar nerve is coming off of your brachial plexus in the shoulder, and it runs down your elbow right over that trochlear notch. Excuse me. And that trochlear notch kind of exposes this nerve. So when you whack your elbow, you get that tingling, prickling pain that radiates down your hand. All right. So it says the symptoms of your funny bone or tingling sensations radiating down the ulnar side of your forearm. Now, I've never heard this before, but I guess maybe in some other places in the country, the funny bone is sometimes called the crazy bone. Never heard anyone refer to it as a crazy bone, but I guess it is. All right. Another nerve that is worth mentioning is also coming off of this brachial plexus, and it is called the median nerve. The median nerve runs down your arm and then into your hand. So you can see this pink area is the median nerve, and the median nerve is going to go into your hand and innervate your hand. If the median nerve gets inflamed due to swelling or compression, this leads to something called carpal tunnel syndrome. So carpal tunnel syndrome is going to cause numbness, tingling, pain in the fingers, especially your index finger. And it can be very uncomfortable, especially when you're trying to do basic things like type. Really what's happening is the connective tissue around, so that epinurium around the median nerve becomes inflamed and it swells up. When it swells up, it puts pressure on that nerve and causes all this pain. So the technique of carpal tunnel syndrome surgery is they'll go into the wrist and they will relieve that pressure by cutting away some of that connective tissue. When that connective tissue is cut away, the nerve doesn't have the pressure on it anymore, and we relieve that pain. All right, another thing to note is in our sacral region, we have the sciatic nerve. And here you can see the sciatic nerve comes off the sacrum, and then it runs down the length of your leg on the back of your leg. If this gets damaged, we call it sciatica. Sciatica is a condition where the sciatic nerve is inflamed or pinched, and it can cause a lot of discomfort. So it says symptoms include pins and needles in your legs. You have a radiating pain down the leg. There's some numbness. It can cause weak muscles. And there's a lot of different things that can cause sciatica. So it says a herniated disc is an example, some type of injury. Women who have had a child, childbirth puts a lot of pressure and stuff in the abdomen and the sacral and pelvic region as the baby's being born. So that can actually pinch the nerve and cause sciatica. If you've ever had sciatica, you'll know it's really painful. It actually, a lot of times it hurts your lower back, kind of your butt, because it runs down the back of your leg. So it'll hurt your butt and then down into your leg. All right. The sciatic nerve has two common branches, the tibia and fibular nerves that are coming off of that big sciatica nerve, just to let you know. All right, the last thing I want to mention are dermatomes. Dermatomes are areas of skin that are innervated by specific spinal nerves. So it says here that all spinal nerves except for our C1, the very top one, innervate a specific constant segment of the skin. And the skin segments then are called dermatomes. Now, dermatomes can be very helpful in diagnosing nerve injuries. So, for example, if someone has a spinal cord injury or if there is a problem with the spinal cord, we can usually determine that very easily by running a dermatome test. So let's look at the dermatomes. Here is a dermatomal map. And so it says specific areas of the skin are supplied by spinal nerves. So if we look at this, for example, our cervical nerves are going to innervate our arms. So you can see the areas of skin that are innervated by C2, C3, C4, C5, 6, 7, 8, etc. All right, so these areas of the skin are sending sensory information and receiving motor information via that specific spinal nerve. So remember, C1 doesn't do this, so it's the exception. So we start with C2, back of your head, C3, kind of your neck, C4, your shoulder. Then we get into our arms, C5, C6, C7, C8, or your hands. So all of these are innervating specific skin areas. Now, if there's any nerve damage, the patient may have numbness or paralysis wherever that damage has occurred. So it says nerve damage regions of the spinal cord can be distinguished by patterns of numbness over these dermatomal regions. On a more positive note, if someone needs anesthetics, we can also administer anesthetics across these spinal nerves. and that can numb and deaden a person for pain relief or for surgery. So it says the spinal cord transection. If someone has a damaged spinal cord, it says injury that severs the cord will cause loss of sensation below that injury. And this is really how they can determine a potential spinal cord injury, is they will run a little tool that is kind of a pokey wheel, and they will start at your feet because that's the lowest area. See S1, S2, S3, S4, S5. So they will run a little tool, this little wheel, across your dermatomes. And if the patient cannot feel it, they just keep working their way up until the person says they can feel it. Wherever they can feel it, let's say they work up through the sacral region, through the lumbar region, the patient can't feel anything. And then they get up to like T11, and then they can feel things in their abdomen, but not below. Well, then they know that the injury to the spinal cord happened right at, let's say, T11, because there will be paralysis and numbness below that region. So the dermatomal map is a really handy way of checking the health of a nervous system, but it also is a good way that we could administer anesthetics, because if we know what part needs to be operated on, a lot of like outpatient surgery, person comes in to get something worked on, they can deaden that area of the spinal nerves, causing numbness over that dermatomal region, and then they can do their surgery that way. That way they don't have to knock the person unconscious. All right, so some vocabulary words here to just end everything. So general nervous system disorders. Anesthesia is anything where we have loss of sensation. Hyperesthesia is an increased sensitivity to our nervous system. So you have an acute sensitivity to things like pain, pressure, that sort of thing. Paresthesia is that tingling and prickling. So if someone has sciatica, or even if you just sit on your foot and it goes to sleep, you get up and then you have all that tingling, prickling, burning sensation. That's called paresthesia. Neuralgia is any inflammation of nerves. It can end up with a stabbing pain. So, for example, if you have back pain, you might have neuralgia where the nerve is inflamed, and that can cause a lot of pain. I already mentioned sciatica. That's the sciatica is the inflammation of our sciatic nerve, causes radiating pain down the back of your leg. And then there are several infections that affect the nervous system. For example, herpes, both herpes simplex 1, which is like oral herpes that you get cold sores, and herpes simplex 2, which is the genital herpes, affect the nervous system. So they move through the virus moves through the nervous system and erupts as skin lesions. So cold sores or genital herpes are skin lesions. Shingles is another example. Shingles moves through your nervous system. Shingles is the chickenpox virus, and it manifests itself usually as the person ages as an adult. This is why you go to Safeway or whatever and you see shingles vaccines. What they do is they give you a chickenpox vaccine to knock down that chickenpox virus. What's really interesting about chickenpox virus is if you've had chickenpox, you will always have the virus in your body. It never goes away. Your immune system just controls that virus. So once you've had chickenpox, you have that virus. And that virus, as we age, because our immune system can get weaker, our immune system can't fight that chickenpox virus and keep it under control. So it can manifest itself again. But you don't get chickenpox again. It moves through your nervous system, and you end up getting this thing called shingles, which is a really painful rash that is on your skin. It usually affects like your head, shoulders. It can be on the person's face, but shingles is very uncomfortable, but it's caused by a virus moving through the nervous system. Another example is polio. Polio is a debilitating disease caused by another virus that affects children. So it says it causes infantile paralysis. But polio was once just a horrible disease for kids back in the early 20th century. In fact, your grandparents, great-grandparents probably knew a person who had polio. I had a great uncle who had polio as a kid, and throughout his adulthood, he was affected by it. It kind of contorted his body because some muscles were paralyzed. He had to always wear oxygen to help him breathe. And then polio was nearly eradicated with a vaccine discovery. So we discovered, actually it was Jonas Salk, the scientist Jonas Salk, discovered a polio vaccine. And so now when you go into kindergarten, you get a polio vaccine right away. Actually, you might get one earlier than that. I'm not sure. Some of you probably know more about this than I do. But you get a polio vaccine, and then you are immune to the polio virus. And that's important. One other thing that affects our nervous system is syphilis. Syphilis is an STD, sexually transmitted disease, or I guess now we call them STIs, sexually transmitted infection. But syphilis back in the day, I don't know, around World War II or something, they called syphilis venereal disease, or VD. Syphilis is a bacterial infection. It's not a virus. It used to be a death sentence before the discovery of penicillin and antibiotics. If someone got syphilis, it would kill them. It moves through your nervous system and ends up in your brain, causes the person to, well, basically become insane. Just an interesting note, the famous gangster Al Capone died of syphilis in prison. So pretty cool. All right. So there also are some genetic and autoimmune diseases. Myasthenia gravis is a genetic disease where you're not making enough acetylcholine, so that your muscles become weak and the junction between your nerves and muscles are affected. All right, so that takes care of our Chapter 13. So there is a Chapter 13 quiz this week. Make sure that you take it. Starts on Thursday, goes through next Monday, the 28th. And then we're going to move on to Chapter 14. Also, don't forget, I'm combining Test 5 and 6 into one test to make my life easier. So the final will be over Chapters 12, 13, 14, and 17. And so that'll be during finals week. All right, I will see you all later. Have a great afternoon.